This is Angela, the baby nurse. This is right now a really tired nurse after a really crazy night. So forgive the look, forgive the exhaustion, forgive the bed. I just thought about a couple things. I figured I want to do a quick little video to the very handful of people who watch. But it makes me feel good to do this. Hoping maybe there's a couple people who may get some benefit and some good education. If you do like any of my videos, please subscribe or comment below so I can know I'm doing a good job. If you don't think I am, let me know that too. Let me know how I can improve other than put some makeup on and do my hair. I do apologize again for the tired look. My babies beat me up last night really bad. They loved me, but they beat me up and then kissed me when they were finished. Okay, so I wanted to talk about labor first. When you're in labor, a lot of nurses and physicians, PAs, or midwives sometimes leave the patients with oxygen on their face throughout the whole labor. Most patients, most mommies to be do not need it. Okay, guys, you have a right to ask the healthcare professionals, can I take this off? Does the baby look better? Majority of the time they do, and you just needed it for a little while. Just because you need it does not mean your baby's severely sick. You know it's time to worry when you're in labor, when you see 4 or 5 people running into your room at the same time. Don't panic for beeping. Most of the time, beeping is just paper, or you need to fix the little oxygen thing on your finger, okay? We are constantly watching those monitors. So please, guys, don't be worried and panic. I know it's normal to worry, but there's always someone looking at the monitors. Your job is to rest until it's time to have your beautiful baby. Okay? Now, when you're 10 fingers open, 10 centimeters fully dilated, however you want to refer to it, does not mean baby's going to come sliding out. You do have some time. Usually you can get to 10 fingers open and you still may have another 4 hours. Some cases even longer before you have the baby. Ideally speaking, from a nurse's perspective and from a woman who's had 3 children, you ideally would love to deliver birth vaginally. 12 24 hours of pain or 8 weeks of pain. I take the 12 to 24 any day without an epidural, then have another C-section. 2 of my babies were vaginal. 1 had to be an emergency C-section. If I had a 4th, I will stay home until I can't take it no more. I will never want to experience that post-operative pain in my life again. My personal opinion. Forgive me again, I know I'm a mess. I just never have time to post any videos. Okay, again, all right, go back to the video. I'm so sorry. Okay, so, all right. So let's say you push, baby comes out. Okay, if everything's fine, no issues, okay, you can ask if the baby can be placed on your abdomen to be dried and stimulated, okay? After 9 months of pregnancy, sometimes a little less, sometimes a little bit more, you want to see that baby and hold that baby and love that baby, okay? So sometimes it's so beautiful to just have the baby on your abdomen right after you've done all that hard work. Mommies, if you're not up to it, Daddy, if you want to hold the baby, you can. Ask the staff, ask the nurse. I've even had I've had some fathers take off their shirt, sit in the chair, and I put the baby directly on their chest if mommy's not ready. Okay, daddies can do skin to skin too. It's a beautiful thing. Babies know their mommies and daddies. You hold and love them. Okay, because you'll blink your eye and they'll be leaving your house and grown up one day. Enjoy it while you can, guys. Okay? Now, so let's say everything goes good. You're bonded. You did your skin to skin. Ideally speaking, hopefully you're breastfed within the first hour. Usually, delivery and recovery right after the baby's born is usually about an hour to 2 hours. Depending on what was going on, it may take a little faster, may go a little shorter. Most moms can eat about an hour after the baby's born if everything's good, bleeding is normal. Okay, now your uterus is where the baby used to be. Now, when the baby comes out, you're still going to have a little belly. You're not going to go flat right away, ladies. I'm sorry. Okay, but it will go down. Okay, now for 6 weeks, you're going to have discharge. I say discharge because for the first week or two, it's bloody. It shouldn't be changing a saturated pad every hour. If that is happening, that is too much. You have to let somebody know. Okay? Now, but for 6 weeks, you will have some sort of vaginal discharge coming out. If you go from bright red blood to a little darker, little yellowish, that's normal. But if you go from dark red blood and then it's getting brighter and heavier afterwards, that's not normal. It should be getting lighter and smaller amounts, okay? Don't lift anything heavier, ladies, than the baby for the first 6 weeks. If you're a C-section, don't lift anything heavier than the baby for 6 to 8 weeks. You should not drive until you're cleared to do so by your OBGYN, okay? Ladies, for your bottom, if it's sore, you can ask them for special spray and cream to help with the vaginal discomfort. Sometimes if you have a laceration or an episiotomy, it may burn. Okay? So, okay, I'm losing my track of thought. Okay, 1 second. 1, 2, 3. I forgot what else. Okay, all right. Now, if you were a C-section, sometimes you can ask for a special belt around your abdomen to help with the incisional discomfort. To be honest, I used to use it even after my vaginal delivery because I think it helps you get your tummy smaller quicker. Nothing wrong with that. Breastfeeding helps that too. And it also helps you recover faster after a delivery. Breastfeeding, and it's healthy for the baby. I am the ultimate breastfeeding advocate, just so you know, if you're not aware of that already. Okay, now the baby usually gets their first bath after you've gone to mother baby. Okay, usually it's usually after 1 hour birth. We have to make sure the baby's temperature is okay, check the baby's vital signs, and make sure there's no issues before we give bath. Okay, now if you have any concerns, don't be afraid to ask. Now, C-sections that are being C-section for breech, those babies need sonograms of their hips to make sure there's no hip issues. Okay? If the doctor at any time tells you the baby has a tube vessel umbilical cord, don't panic. It's not a reason to panic. But they do have to do usually a routine kidney sonogram just to make sure the plumbing is working. Some babies can have some problems peeing if they have a two-vessel umbilical cord. Majority of the time, though, they're fine. Okay? If a baby's in distress, we can usually tell it by looking at the heart rate, okay? Again, don't let alarms scare you while you're in labor, guys. Okay? If it's an emergency, you usually see a bunch of staff people running in the room, okay? But if you're not sure, ask what's normal, what's not normal, okay? And